morning, everyone. Make sure that we're all awake. Good morning, everyone. Good morning. Thank you for coming. To the Honorable Minister of the Health of Environment, Minister Trevor Munnis. It's trying to hide behind me there. JP, MP, other distinguished members of Parliament, distinguished guests, MoonGate Insurance Associates. Specifically, I have Teresa Roque, who has been instrumental in assisting with this. The Director of Age Concern, Claudette Fleming, and members and friends of Age Concern. Welcome to the launch of Health Gap AC. My name is Leon Bascom, and I am the President and CEO of MoonGate Insurance. And firstly, I'd like to thank God for giving us this vision and opportunity to truly give back to our community and help numerous individuals. People ask, how did this program start? Well, MoonGate, as an agent of the Health Insurance Department of the Government of Bermuda, has a very close relationship with the Director, Colin Anderson. And when we were meeting with him, we were identifying some places where there may be some void in some of the policies. And we initially started in terms of looking at the air ambulance. As many people know, the air ambulance services could be very expensive. And so in our discussion with him, what we initially done was we teamed up with our friends from MASA, and I will introduce them shortly, and we helped to fill some of those gaps. And so what we did was focus on the additional gaps in cover that are specific to the hip and future care, and we continue to work on those. We certainly met with Claudette Fleming and her executive team to tailor-make the Health Gap AC product for their membership. So you must applaud Claudette for her vision as well. Some people may ask, why is this important? There are certainly many policies, not just hip and future care, that don't cover everything. And what happens is that certain individuals are left with what we call a copay. So whatever the government or whatever your policy covers, if it covers 60 or 70 or 80%, a person is left with a copay of, say, 20%. And so what the Health Gap does is address some of these concerns with regard to the copay. So these are, and I'll talk a little bit about it, these are certain benefits and services that help to fill in some of those gaps. Now, I'm going to talk a little bit about the features. The Health Gap product basically is a collation between international and local service providers offering special services and discounts to members of the Health Gap AC program. Originally, again, we went to Claudette and we spoke to her team. We had some features in there, and Claudette's like, that's not good enough. We need to have some more benefits for our members. And so we were able to go back and we worked on that, and we now have a collation of benefits that hopefully are relevant to your policies. Let me also now go on to again, I mentioned about the visionary partners, the partnership with regard to Colin Anderson and his group. They certainly were very instrumental in determining what are some of the voids in those products. So we're very excited to be a part of Age Concern and rolling out this product called Health Gap AC. Again, this is to exclusive members of Age Concern or potential members of Age Concern, and I'll have Claudette come up in a while, and she will talk a little bit more of the details. Specifically with regard to the Health Gap AC, we have vendors in there who are providing discounts which range from 10 to 15%, and I'm just going to mention a few of them. Actually, I'm going to try to mention on the local side, we have Dr. Kaiwan Brown. He's been very much a lead with regard to some of the provision of his services, and we thank him for it. and his team at North Shore Medical Aesthetic Center. Dr. Gil Feather, he's providing some of the items with regard to the Bermuda optical, your vision and your glasses and your other eyewear. We have Caesar's Pharmacy, who has joined the program, and we're excited to have them in terms of providing some discounts with regard to some cover that you may not receive. And certainly we have, Glenn Robinson of Ashland Clinic. And what he does is he provides some massage therapy services. We have Medical House, and we have a representative here, Tanae Ferbert, and we thank you for joining us. We also have MedDependent, which is a device which helps to call someone in the event of an emergency. We have services from Fortress Limited, which provide accounts receivable services, and we're thankful to them. And most recently, as recently as yesterday, and I promised her that I would mention it, the Athletic Club has come on and joined this program. This is, like I said, as recently as yesterday that Ms. Scott certainly called up, and we had a conversation, and we still have to work out the details, but we're very excited to be doing that for you as well. On the international side, and these are, I guess, the majority of people who are behind me, and first of all, give them a round of applause and welcome them to Bermuda. On my left, I have Mr. Reggie Anderson and Mr. Rodney Cross from Medical Air Services Association. We call them Bermudians because they've been here for so long, and they come to provide some additional information, and I'm certain that people have questions with regard to the air ambulance and their services, so we welcome them. We also have Mr. Dennis Dubecki. Sorry. Mr. Dennis Dubecki, he is also a part of the program, he and his team, and they provide a very interesting service. What they provide is bill negotiation. So I was talking about that copay. So if you have that copay that's left, let's say that you had a surgery and it was $100,000 and the Future Care paid 75% of that, then you will be left, say, with that $25,000. Well, Mr. Dubecki and his team will be negotiating medical bills on your behalf. So we are excited to be welcoming him and having him as part of the group. And to his right, we have Mr. Pramod Go. Hopefully I presented it right. And he is from Placid Way. And he provides a very unique service. A lot of us go to some of the more expensive hospitals along the East Coast in the United States. And what Mr. Go provides is alternative locations in terms of still essentially getting the quality care that one may require. But if for instance, there is an operation that costs, say, $70,000, there are other locations worldwide. There's a big world out there, Bermuda, and certainly we want to open your eyes and provide education with regard to some of these alternatives. So that $70,000 surgery can be, as little as $10,000, $20,000. So we're looking to save money in various ways. Certainly, we continue to speak to both local and international vendors. What we have is really the beginning process of the Health Gap series. And we're very excited to be working with Age Concern with regard to this initiative in terms of the first rollout. There are questions in terms of how much does this cost? This is one question that always seems to come up that actually is the first issue that I should have addressed. But the cost of this is $70 a month, $70 a month for those people who are members of Age Concern or want to be members of Age Concern. So this is a special price. Again, this is a collation of products and services that are designed to supplement any type of health insurance policy. So we're certainly going to be having some workshops soon. But in conclusion, I want to say and re-emphasize that our mandate at MoonGate Insurance is really for us to be here to help. We want to help our seniors. We want to certainly help the Bermuda community at large. We want to provide information. We certainly want to ensure that people do read their policies. We want to make sure that people are informed. And we will certainly do the best that we can to assist in bringing down even some of the costs in terms of Bermuda's healthcare environment. So if there are opportunities for us to, say, go to places like Colombia or places like the UK in terms of getting quality care, and we don't necessarily need to go to the United States to get, John Hopkins, and it's nothing against this. My mother, who's here, she went to John Hopkins, and I'm very appreciative of their services, but we certainly want to educate you that there are alternatives. There are alternatives to certainly the pricing. We've had people come into our offices who are paying for their policy, $1,000 and $1,200 and $1,300 a month for their services. And so what we have is the Health Gap product, and we actually team with Hope Johnson. She's standing back with me, and certainly, again, want to appreciate Colin Anderson. What we do is we team up together to provide a complete package so that it enables you to continue to afford healthcare services and products. And to that, I would like to once again thank you for attending, and I would like to turn this over to the minister. Certainly we will take questions initially from the press, and we thank you again for your attention.
Thank you very much, and welcome to everyone today. I would like to thank both MoonGate and Age Concern for setting up this conference, and also for these services, and for giving me the opportunity as Minister to make some brief introductory remarks to show government support for what's being done here. The Ministry of Health and Environment recognizes the difficult economic times that Bermuda faces and the difficult fiscal situation that the government faces. We are acutely aware of the high cost of health care in Bermuda, the present inequalities in healthcare spending, and the complex, fragmented healthcare system that currently exists. We can also appreciate how this cumulative set of circumstances can make obtaining the right care in the right place at the right time and at the right price difficult for certain segments of the population, and for seniors in particular. We are glad to see such a unified, collaborative approach that provides additional non-insurance benefits to our seniors. At the heart of the Ministry's strategic priorities is the long-term aim of making the healthcare system more affordable and accessible for all, while improving its sustainability and quality. In short, we want healthy people in healthy communities, and we are optimistic that today's announcement is a big step in that direction. Thank you very much.
Thank you, Minister. And at this time, we will invite Claudette Fleming, who is the Director of Age Concern, to come and give her remarks. Thank you.
Thank you, Leon. To the Honorable Minister, Trevor Munnis, thank you so much for coming today and supporting this initiative. To any Age Concern directors who are in the audience, of course, Leon and his team at MoonGate, and the associate partners, and industry colleagues who are in the audience as well, and most importantly, you are members of Age Concern. It is my pleasure to be a part of this historic occasion of the introduction of Health Gap AC, offered by MoonGate Insurance for the benefit of the Age Concern membership. These are indeed interesting times in Bermuda, times when pockets are lean and budgets are mean, times when healthcare costs have become the central focus of conversation and concern, and rightly so. In 2013, the Bermuda Health Council released a very helpful healthcare expenditure brochure on statistics concerning the current state of healthcare costs in Bermuda. The flyer identified some very interesting economic trends. For example, health spending in Bermuda is growing faster than GDP. The cost of hospitalization claims is increasing in Bermuda. the insured population of Bermuda is decreasing. Health spending per person continues to grow each year. News of the spiraling cost of health care may not be enough to get the attention of the younger Bermudian. However, senior citizens have identified that they are well aware of the cost of health care and its impact on their financial well-being. In June of 2013, Age Concern conducted a survey of its membership. Over 600 members responded. More than 60% of respondents indicated that healthcare costs were their primary concern. It is no wonder then that the Minister of Community and Cultural Affairs, who is responsible for the island's financial assistance program, recently quoted that seniors account for 2/3 of financial assistance recipients historically. For some, payment of healthcare insurance coverage is an important part of the financial assistance that they receive. So worrying is the current healthcare situation to public policymakers that in his recent budget speech, Minister of Finance, the Honorable Bob Richards, referred to Bermuda's healthcare system as a runaway fast car. Well, that's the bad news. Today, the good news is that if Bermuda's healthcare system is the proverbial runaway fast car, then Health Gap AC is the proverbial Volkswagen. In preparation for this speech today, I looked up the controversial history of the Volkswagen, which is the final result of the 1930s People's Project in Germany, a series of hybrid car design programs aimed to achieve a classy yet affordable automobile for the average person, as the average German could only afford a pedal cycle at that time. While the People's Project and the Volkswagen have a tumultuous socialist past, few can argue that the well-known Volkswagen Beetle grew to be loved by many private car owners worldwide. Age Concern is pleased to be a part of the launch of Bermuda's healthcare coverage Volkswagen Beetle, Health Gap AC. Health Gap AC represents an affordable healthcare insurance package that exists to top up existing healthcare coverage. The insurance package has been designed specifically for members of Age Concern, persons 50 years and older, the people that we serve. We look forward to the success and expansion of this affordable insurance package and are grateful to the MoonGate insurance team for delivering this vitally important product to the current healthcare insurance market of Bermuda. Thanks very much.
Volkswagen Beetle. I like that analogy. Oh, it's okay. It's okay. Thank you very much for your kind words, Claudette. And certainly, once again, we are working in conjunction with a number of persons at Age Concern and also with our vendors. Certainly, if there are additional vendors out there who want to be a part of our team and want to provide some additional services, certainly you can contact us. We're located right across the street on Church Street in Sophia House. We're actually on the ground floor of where HIP and Future Care are located, so we're right in the same proximity. I just want to talk about what's coming up. And first of all, I certainly would like to thank the media for coming and helping to spread the word in terms of this exciting initiative. And again, we're going to take some questions, I believe. We're going to take some questions, I guess, from the media, if they have any questions. But before getting to that, what I will do is have a very quick rundown of what the proceedings are going to be. I am 5 minutes early, but what we will do is at 11:30 we're going to have the Health Insurance Department. They're going to talk about some of the benefits of HIP and Future Care, and they're going to talk about how some of the coverages that are not covered are provided, sort of like through the Health Gap program. So we thank Hoop for standing for calling at this time. Then we will certainly have Mr. Pramod from placid way. He will provide some information. Again, we're all about disseminating information for you, the public, and so we're excited to be doing that. And then we will be serving refreshments at 12:30 until 1 o'clock, and then at that time we will have the Medical Air Services Association team give their presentation. These presentations are only 20 minutes long, and we want to leave it so that people can ask questions. So it's sort of like a brief information session, and then we want it to be interactive in terms of you being able to ask questions. We have Dr. Kaiwan Brown, who is scheduled to attend at 1:20, and he's going to give some information in regard to some of his services, the items that he's providing within the Hill Health Gap package, and we're excited to have him. And then we're going to have Mr. Dobecki come, and he's going to talk about that medical negotiation that I spoke to you earlier about. And then I think we have someone from Medipendent who's going to come and speak for a few minutes. And then at 2:10, we are very pleased to be having Jennifer Attride Sterling from the Bermuda. She's the CEO of the Bermuda Health Council, and she will be providing some information with regard to changes to the standard hospital benefits. So we are thankful that you are attending as well. And again, we thank you for your attendance, and at this time we will take any questions from the media. Thank you.
How many members do you have that will benefit from this new program? The question is, how many members benefit from this program, this new program?
We have approximately 2,000 members, and those are the people that we will be providing information to about the product. Today, we have about 100 members in attendance.
And how does one, those that are not signed up, is concerned, become affiliated?
They can call us on 238-7525. They can walk into our office, 25 Point Finger Road. They can email us at info@ageconcern.bm, or they can go on our website at www.ageconcern.bm. Membership is $20 a year for persons who are 50 and over. So Trevor, I think I could see you afterwards about a membership form. Yeah, 50 and over. And certainly, if you cannot afford membership, please speak to us about that as well, and we'll accommodate you.
Thank you, Minister. This one is for the Minister. Minister, I know the Minister Scott, I felt should have been here. That's one. Two, I'll speak personally. My grandmother did. Her benefits run out, say, in November. How can you comfort these individuals that from November to the new fiscal year, that's 5 months, 6 months before their assistance kicks back in? How can you comfort these folks? And
when you say benefits, you're talking about future care?
Future care assistance.
Because he handles financial assistance.
That's why I said that he should have been.
Yeah.
But you as the Minister of Health.
But yes, in terms of the overall health system, you know, we're under a complete review of the health system. So we're taking all of the research that was done previously for the health plan. We're going to use that in developing a new strategy. We obviously have to concentrate on making health reform changes that will be financially sustainable going into the future. So we will be trying to provide better service within our budget.
But my question is, how soon do we have a fix for individuals that need assistance in medication? Because that's for 6 months, 5 to 6 months. Myself, my other cousins that helped to pay my grandmother's medication.
Well, I'm not going to.
Everyone else in here is doing the same.
I'm not going to suggest to you there's any immediate fix. You're talking about prescription benefit.
Yeah. Anything that would help the seniors. Anything.
Yeah,
how quickly can we get some type of resolution?
All I can say is review it. You can come to me and ask me for anything except money. So if it takes money, it's the one thing we don't have. So, but we will be trying to make the system more efficient, more effective, and we will be reviewing all of those benefits.
Thank you very much, Trevor. And certainly, that's where we're trying to address some of these issues, because currently, as part of the health gap, again, I mentioned that one of the vendors are providing 10%. Yeah, we would love it to be 50% off of your prescriptions, but something is better than nothing, and that's certainly where we've started. And again, we continue to talk to other pharmacies on the island, and again, we welcome them to assist in this. Thank you.
So I was going to ask you what $70 a month is going to get folks, but I imagine that's going to depend on the policy, is it?
Yes, I mean, I'm not sure how soon you came in, but certainly there are a litany of benefits that are in that health gap program. And again, some of these folks are the members of the team that provide a lot of these products and services.
Are there any services that are common to all policies?
I mean, certainly, I mean, the first thing that comes to mind is the air ambulance piece. I mean, certainly, there are a number of policies that provide the air ambulance, but it's only people like me that actually read policies. I have an underwriting background, and these are the things that I have to do. And what people don't realize is that there may be a limitation with regard to your air ambulance piece. It may, for instance, I know that there is a policy out there that only provides $25,000 in cover. What if you have to get flown out and it costs $40,000 or $50,000? It all depends on your circumstance in terms of the cost. And so therefore, we try to sign up for the best.
But with us, there's no limit with mass.
And it's being re-emphasized that there's no limit with regard to, in our program we have the MASA folks, there's no limit to, if we have to fly you out and it costs $100,000, then that is paid for with regard to if you're a member of the whole health gap series. So there is no limitation with regard to that.
And would that kick in right away once you've made your first payment?
Yes, once a person signs up, and we have sign-up forms, and certainly we're going to be handing them out to all those who are in attendance. Once you sign up, usually we sign up for the 1st of every month, so the 1st is going to be for April the 1st, and so we want to ensure that we sign up as many people as possible with regard to these benefits. Yes?
My question is, because I belong to Future Care, this is a supplement if I wanted the air ambulance?
Yes, that's right. That's right.
So
exactly. So, yes, so your Future Care remains the same in terms of its cover, all of your hospital. That's right. So this essentially, this health gap will sit on top of your Future Care or sit on top of any policy, and just in terms of its benefits and its services. Yes.
I was reading the brochure, and it says something like $510 and then $400 and something.
That's right.
What does that mean?
That's right. Well, what that means is that we've taken the Future Care, which is $440, and we've added the 70 on top of it in terms of the cost. So that's how you get to the
Okay,
$510.
so my question is,
Yes.
can one belong to your health gap AC,
AC.
and not Future Care?
Correct. You can. This is mutually exclusive.
switch
That's
over.
right. It's mutually exclusive. You can have it separately. The question was, whether a person can essentially purchase health gap on its own and remain on my Future Care. You are certainly able to do that. So it's $70 on its own for those people who are part of who want to purchase the health gap separately. But again, as mentioned earlier, we are agents for the health insurance department, and we are able to provide you with a one-stop shop in terms of putting that entire package together. So we will make a seamless transition with regard to your Future Care and health gap all in one. So that's actually called the milestone policy. When you get your pamphlets, you see milestone package, and that includes your Future Care as well as the health gap AC.
Well, I have a question then.
Yes.
Can I join anytime?
You can join at any time. Yes.
Because my policy, let me see, I'm really an alien. I'm Bermudian, but I was away for 38 years, so I paid $2,606 a month for future care.
Sorry, I'm sorry. Can you repeat that? You paid. Sorry, she will certainly.
No, I'm telling the truth. I'm born here, but I'm really alien.
Okay.
In other words, I've been away for 38 years.
Okay.
So now I'm considered, I have to pay $2,606.
You have to pay.
That's what it is now.
You have to pay $2,606. We should speak afterwards.
Monthly, because I will be here
Okay.
10 years in October.
Okay. Well, we should speak afterwards with regard to your particular case, because we have people certainly qualified to be able to help address that.